Hi, good morning. So today we have Christy, who is my beautiful patient, and she has synkinesis. And synkinesis is a very unusual sequelae or complication from Bell's palsy. About 10 to 20% of patients who have Bell palsy develop this. And what this is she has involuntary muscle movements interface when she voluntarily moves certain muscles. And they think this is due to abnormal growth of the nerve endings. And then I'm going to have Christy tell you what her symptoms are.
It's very uncomfortable. Everything seems to work incorrectly. If I smile, my eye closes. If I blink, my mouth pulls back. My neck muscle tightens, I guess you could say. When I go to sleep at night, if I close my eyes, my mouth is pulled to the side. It's just very uncomfortable. I get the TMJ feeling a lot in my cheek from that.
Yes.
Yes.
Christy came in to see me about 5 months ago or so,
yes.
and we injected Doxify in her because was at that time it was a newer neurotoxin that lasts longer. And I also questioned Christy about biting her cheek, because in the literature they also state that some patients also bite their cheek because the buccinator muscle is a little overactive, and I did that for her last time. And how did that work for you, Christy?
That was perfect. I felt a change within just a couple of days, and I honestly didn't realize that it was that big of a problem, but noticing the difference of the change, it was perfect.
Okay.
Yes, it was the best. I think the best change I noticed after you did anything at all was that.
Okay, so after we did your injections around your eye, and then we also injected the risorius muscle, which pulls the lip to the side, which is what you have an involuntary contraction of. And then we also did your obicularis to open up your eye, and then we did your platysmus muscle. So what symptoms did you experience after the doxy took effect?
All of the symptoms were better. Probably the worst symptom that I have had is when they started to wear off was like the tightening of my cheek was probably the worst. I feel it more in my neck too. Other than that, I think the symptoms have been so much better.
Okay, so you have a little bit of the symptoms now. We just treated her. And go ahead and show us what happens. Okay, so when she smiles, this eye closes. Okay, and then close that eye, and then does that pull that mouth to the side?
It does.
So her risorius is being pulled, and also her platysmus is being activated. So that's what happens when the toxin wears off. Okay, well, thank you very much, Christy,
thank you.
for explaining your symptoms and being my patient.
Of course, thank you.
Thank you very much.